Colleagues, I rise today as a proud author of SCR 75, recognizing June 2025 as Alzheimer's Disease and Brain Awareness Month in the state of California, and June 20th, 2025 as the Longest Day, a symbolic global movement where people come together to honor the strength and endurance of those living with Alzheimer's through advocacy, awareness, and action. Alzheimer's disease, while often thought of as the condition of aging, is deeply connected to the broader public health picture, including issues of gender, race, access, and care infrastructure. It is especially personal and urgent for me because 2/3 of Americans living with Alzheimer's are women. In fact, among the 7.2 million Americans living with Alzheimer's today, 4.4 million are women. The reason for this disparity are still being studied, including by UCSD's nationally recognized Alzheimer's Disease Research Center, which is at the forefront of groundbreaking research. Their work is supported in part by federal funding which is now at risk for being cut, a move that would severely hinder progress towards new treatments and preventative strategies. California, unfortunately, leads the nation in the number of residents with Alzheimer's disease, around 7,200,000 individuals, and that number is projected to more than double in the next 2 decades. While our overall population is expected to grow by about 16%, the number of Californians with Alzheimer's will increase by a staggering 127%, and communities of color will be disproportionately impacted. This is not just a public health crisis. This is one that also has a severe impact on families. More than 1.3 million Californians are unpaid caregivers for loved ones with Alzheimer's, providing over 1.8 billion hours of care each year. While that care is valued at $44 billion, the emotional, physical, and financial toll it takes on families is immeasurable. The burden on these caregivers, most often daughters, granddaughters, and spouses, is staggering. Many are juggling jobs, raising children, managing household, all while providing complex and continuous care to a loved one with dementia. The result is heightened stress, increased rates of depression, and serious physical and financial impacts, including caregiver healthcare costs estimated at $134 million in 2015 and projected to rise by $182 million annually by 2030. And yet, despite the scale of this burden, less than half of individuals with Alzheimer's receive a formal, disclosed diagnosis, creating further obstacles to care planning, timely treatment, and access to critical support services that families urgently need. The urgency to act is reflected in the innovative work being done across California and the nation, including the Healthy Brain Initiative, a collaboration between the CDC and the Alzheimer's Association that equips public health systems to promote brain health, support early detection, and integrate dementia into a chronic disease prevention strategy. Together, these coordinated, equity-driven efforts are now transforming what we know about Alzheimer's and how we respond to it. Colleagues, as we work to strengthen California's healthcare system, we cannot overlook this looming public health crisis. Alzheimer's is unfortunately not curable, and there is no proven way yet to prevent it. But we can fight for early detection, robust caregiver support, and continued investment in research. This resolution is a commitment to Californians currently living with Alzheimer's, to their families, to future generations, and to equity in the healthcare access and outcomes. With that, colleagues, I respectfully ask for you to support this resolution. Let this moment elevate our awareness to promote brain health and recommit ourselves to finding solutions that support all Californians facing Alzheimer's disease and other dementias. And I want to thank all of my colleagues who are wearing purple today in support of this resolution, SCR 75.